Did you know that drugs in this same class actually work at different targets? In just 3 minutes, we'll break it down so it sticks, both for your exams and for clinical practice. Let's start with a quick tour of the nephron. Proximal tubule. Most of the water and nutrients are reabsorbed. Loop of Henle, concentration and dilution. Distal convoluted tubule, fine-tuning sodium and chloride. Collecting duct. Sodium in, potassium out, and hydrogen plus bicarbonate for acid-base balance. Here's a common exam trap. Spironolactone works in the collecting duct's principal cells, but textbooks often say distal tubule, but many actually mean the broader distal nephron that includes the distal tubule and the collecting duct. Aldosterone is lipid-soluble, so it enters principal cells in the collecting duct and binds to the mineralocorticoid receptor. Mineralocorticoid receptor moves to the nucleus and increases expression of 3 key players. ENaC, the sodium entry channel on the apical side. Sodium-potassium ADPase pump, the pump on the basolateral side. ROMK, the potassium secretion channel. The result? More sodium and water reabsorbed, more potassium excreted, and blood pressure goes up. Important! This is a genomic effect, so it takes time to kick in. Mineralocorticoid receptor antagonists, spironolactone and eplerenone, block the mineralocorticoid receptor. That means ENaC, sodium-potassium ADPase pump, and ROMK are not upregulated. So sodium reabsorption falls, water follows, blood pressure drops, and potassium is spared. The main side effect of aldosterone antagonists is hyperkalemia. In addition, spironolactone can also bind to androgen receptors, which may cause gynecomastia and other hormone-related side effects. By contrast, eplerenone is more selective for the mineralocorticoid receptor and has much less activity at androgen receptors, so these hormone-related side effects are far less common. ENaC blockers, amiloride and triamterene, directly block ENaC on the apical side. They close the sodium door so sodium doesn't enter, the sodium-potassium ADPase pump slows down and potassium secretion decreases. They also cause hyperkalemia, but no hormone-related side effects. Clinical Pearl. In Little syndrome, the degradation of ENaC is impaired, causing excessive sodium reabsorption. As a result, ENaC inhibitors are the first-line treatment for this condition. Quick quiz. Where does spironolactone act? The answer is... Let's wrap up. Mineralocorticoid receptor antagonists like spironolactone and eplerenone block mineralocorticoid receptor in principal cells. ENaC blockers like amiloride and triamterene block the ENaC channel directly. Thanks so much for watching all the way to the end today. On this channel, I do my best to make medicine easy to understand and maybe even a little fun. If this video helped, give it a like, subscribe, and share your favorite memory trick in the comments. See you in the next video.
For quick, powerful reviews, this is the only channel. Don't forget to subscribe.